Right, a warm welcome from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation here with Charlotte and Boo, my co-host and part now of a trio. Charlotte is calling in from Ebolowa, Cameroon, but we also have Corrientes, Argentina represented. Hello, Maria.
Hi, all of you. Welcome. Very happy to be here and very looking forward to hearing David Akpan in this lightning chat.
Indeed, and today's the day we're speaking with David about digital health. Very pleased to announce and to promote eHealth Africa, a leading organization in the field of digital health, as well as EHA Clinics. David Akpan is going to explain to us what is this EHA Clinics and how the two are connected in just about a minute. In the meantime, if you're not yet part of Teach to Reach, well, this is the main global event to meet, network, and learn with fellow health professionals. All you have to do is to request your invitation. It is entirely free. If you want to learn more, we're focusing on climate change and health. You can go to the Gavi website where you'll find a series of articles on the Gavi Vaccines Work website, one of our media partners together with Devex. We're very pleased to have both of those as media partners as well. So here we go. We're going to do the countdown now, with 21 seconds on the clock and 6 days, I believe, until Teach to Reach on the 20th of June, 2024. All right, a warm welcome from Geneva, Switzerland. I'm Reda Sadki. I'm here with Charlotte and Boo and Maria Manzan from the Teach to Reach team. We are 6 days away from Teach to Reach, and today we're talking with David Akpan, who represents eHealth Africa. We're going to dive right in with questions on digital health, and let's ask Charlotte to ask the first question.
Thank you very much, Reda, and once again, warm welcome, David. My first question to you is, eHealth Africa has been at the forefront of using digital technologies to strengthen health systems and respond to public health emergencies. So from your experience, what are the most promising applications of digital health in addressing the health impacts of climate change, particularly in vulnerable communities?
Yeah, thank you very much, Charlotte. So basically, I think it's no-brainer that digital health has come to really make a lot of contribution to addressing health challenges, especially public health emergencies. So without specifically mentioning specific solutions, but there are a lot of solutions that does a predictive analysis, and also trying as much as possible to layer health data and climate data to assess some trends, epidemic trends, and how that could most likely help, inform intervention. So at eHealth Africa, we had piloted what we called ECHO. So ECHO, it's actually a solution that looks at collecting data from different sources and be able to run that predictive analysis to help healthcare workers effectively respond to health challenges that might be informed by outbreaks that are driven by climate related outbreaks, and also kind of like keep them at bay in terms of locations that are more prevailing and locations that need prompt intervention. So that's what I could share.
All right, thank you, David. Now, we do have some folks on social media introducing themselves, so we're going to make a stop here, as well as those in the Zoom studio. So just, again, to emphasize that this is going to be an interactive dialogue, we'll kick off with a few questions and then come back to you. And Duka Ozor said, I can't wait to hear about eHealth and what it's all about. Let's see. Mbabazi Deo, I need to join. I am new. I attended yesterday as well. A warm welcome to the Teach to Reach family to you, Mbabazi. Highway. Ronald Zion, Director of Abscess from Uganda. Welcome to you. Mariam Musa from Kano State, Nigeria. Good to see leaders of the Movement for Immunization Agenda coming in. Lillian Mutua tuning in from YouTube from Nairobi. Tell us, do introduce yourselves. And most important, don't just say hello. Share the questions that you have for David Akpan around digital health. A range of issues he's going to tell us more. We're going to learn together through this dialogue, as well as and Kingsley Kofi Ninero, Community Youth Development Foundation from Ghana. Lucy Pandangyang from Plateau State, Nigeria. Obviously, there are people coming in, David, from a number of countries in Africa, throughout Africa and throughout the world, really. Going to turn to Maria Monzan for the next question to David.
Thank you very much, Rita. So the Geneva Learnings Foundation's report on the frontline of climate change and health, it highlights the complex challenges faced by health workers, from the resurgence of vector-borne diseases to the disruption of health services due to extreme weather events. My question to you, David, is how can digital tools and platforms support health workers in navigating these challenges and building resilience?
Yeah, thank you very much. I think one of the things you will definitely get, that will be very effective for healthcare workers. It's being able to, run predictions, disease trends, right? And the challenge with trying to know exactly where the outbreaks happen. You will not be able to do that if you promptly and efficiently if you're not able to, or you're not using any form of digital application. So what a digital application most likely would do is to, collect all of the data that from different sources, whether they are climate related events, they are public health events, and layer that for you to either geospatially see where the outbreak happens. And you could also most likely also do a deep analysis of which population is mostly affected. And that helps you to effectively, build up a response team, and as well as even measure what could be a reoccurring factor or a factor that could be something to look out for in the future. So in that way, you might most likely have to an opportunity to build a more effective and a resilient response in the future.
Thanks, David. I did want to say a word about our partnership, because it seemed like a logical one. It was a no-brainer in a way, because Teach to Reach itself is in many ways a digital health initiative connecting health workers to each other. Just wondered if you had any thoughts on that, because this may be the first time that you personally are going to be participating, of course, as a partner and representative of your organization. But what does it feel like to see digital health in action with over 21,000 health workers connecting with each other, learning from each other?
I would say, Reda, this is super fantastic. Basically, what you've been able to do is to kind of like close the digital divide, right? I know that a platform of this nature, if you had to do an in-person meeting, what it means is that the cost is going to be high. You're not going to get a lot of persons, who are going to be part of it. And of course, that healthcare worker in the community will not be able to, have this kind of opportunity to learn, to share, to feel the excitement, and also express all of the passion about your work. But looking at using your platform, a digital platform, to connect people, that makes that kind of like closes that digital divide, that kind of like bring that people closer to the point where they can interact freely. And we know healthcare workers are actually doing great work and fantastic work, but how do they get to share? How do they get to connect? How do they get to network with other people without necessarily leaving their health facility, their primary duty of point of duty? And this is what Teach to Reach has been able to do. And we are very excited to really be part of the Teach to Reach edition for this period. Thank you.
Thank you very much indeed, David. Now, I know that eHealth Africa is and has gone global, Pan-African and global. I do want to start in Nigeria. I'm hoping that Mariam Musa, long-time and very committed leader in our immunization community, who is from Nigeria, will be able to unmute and speak. She has her hand raised, so I know she wants to speak. I hope connectivity will be with her today. Mariam, a warm welcome to you. We'd love to hear from you.
Thank thank you, sir. I'm Mariam from Kano State, Nigeria, a health information officer from Murtala Muhammad Specialist Hospital. Sometimes my question goes like,
Okay, Mariam, we've lost you. At least I cannot hear Mariam, and we did not even get the beginning of the question. I'm so sorry, Mariam.
information officers are not data clerk given opportunity. Hello, we are not given opportunity to participate in the community.
Mariam, you're breaking up. I'm going to have to ask you to type your question into the
Can
chat.
you hear me?
Yes,
Hello?
unfortunately,
Hello?
no, not reliably. David, this is, of course, the counter to, these issues happen. And every time we bring people together from all across the world, there will be individuals who have connectivity problems. In some cases, it's really unfortunate because
Hello?
we can tell that there's a story there. But Mariam, I'm going to have to ask you to share your message in the chat. We'll then be able to share back with you. I'm going to go to El Bethel Alimau. You're going to correct the pronunciation of your name, and we'd love to hear from you. You are calling in from Ethiopia, and you'd like to know more about green digital initiatives, but we'd first like to know a little bit about you, El Bethel. Who are you and what do you do in order to, before we share this question for David's response. El Bethel, are you able to speak? Otherwise, this will be the counter example to successfully crossing the digital divide. All right, we have... so we'll keep that question for you, David. We won't hear from El Bethel, and we'll go to Mohammed Aliyu Gafai. Mohammed, over to you. Your microphone is unmuted. I hope you're going to be able to get through.
Muhammad Ali Gafai. I'm from Nigeria. I'm a medical laboratory technician. Hello.
Yes, we hear you loud and clear. If you can speak really loud into your microphone and introduce your laboratory health technician. What is your question for David Akpan about digital health?
My question is about you. I'm a member of teacher. I think since from 1 up to 9, but I'm not participating on any immunization. But how am I going to maybe how can you connect me with any organization to participate in any vaccination?
Okay, so there will be a big vaccination session at Teach to Reach. So your best option, if you haven't already, is to request your invitation for Teach to Reach 10. Thank you, Mohammed. So do you have a question for David Akpan or questions about digital health?
Hello.
All right. Okay, Charlotte. All right. Sometimes this will happen. It seems to be we are again in one of those live sessions where everyone has connectivity problems. I'm hoping it won't be the case for you. And we have a question from Dennis Oqueer. So let's see if we can hear from Dennis. And so we have the question about green digital health, and then a question from Dennis: can your organization support training in digital health and equipment? So, question to you, David. We'd love to hear your response.
Yeah, thanks, Reda, and thanks for the question. Yes, we should be able to offer you training on that. In fact, for something to note, sometime about 2016, EHA started what we call EHA Academy, which is a platform to really build digital health skills across Africa, because we want to make sure that a lot of people are digitally empowered to do their work and to increase, access to services, access to quality data that, is used to take informed decisions. So I would say just go to your Google, which is your friend, and just type in EHA Academy and then just follow that process. You should be able to be enrolled into the program.
All right, thanks, David. And so we have a question from Lillian Mutua, who's been disconnected because of connectivity issues. So this is really the reality of the digital divide is still there. But when you are motivated, when you want to get through, you do. And Lillian's question is, are you using digital health in RCCE? So this is awareness, health education, communication, demand generation. Are there any opportunities for her to explore the same with eHealth Africa?
So we're definitely using a couple of solutions for RCC or maybe broadly around the social behavior change. But one I could most likely, recommend is you could look out for Prompt. So Prompt, it's a product developed by Jacaranda Health that has been tested, and there are a couple more other ones that are out there as well. And it's one platform that enables you to really communicate information to the beneficiaries out there. And of course, if you have interest in learning how to develop SMS-based solution that helps, facilitate risk communication, we're happy to have that discussion.
Okay, wonderful. The next question is from Charles Obiora. I'm also asking him to unmute. The question is, so Charles is a hospital laboratory worker also in Nigeria. Says he's happy to connect. And he wants to know, what does it take to gain skills in digital health?
Yeah, thanks, Charles. So something to really know about developing skills in digital health is that you need to determine whether you want to be a user or you want to be a developer. So I would say that being a developer takes a lot, but being a user and be familiar with using different digital solutions, it's quite easy. It's as good as having the understanding of using every other application, social media application, and those other simple applications. So those ones could be very easy. It's just to understand how to navigate around them and what important role they play, in your workspace. Like, I would possibly recommend the fact that you're in the lab, you should be able to look out for lab information management system that you should learn, and it could improve your work, basically.
Okay, and David, very practically, I can see that there are many practical questions, people who are interested in connecting with eHealth Africa. We're also going to be asking you to introduce EHA Clinics, but for eHealth Africa, I'm looking at your website right now. If I want to get in touch to find the eHealth Africa Academy you referred to, or just want to access the different content, what's the easiest place? Where do I go? Can you help me find, what would you recommend? Is there a place where I can... should I say
right at the top?
Yep.
Right at the top, you would see Academy there.
Yep. Okay. Here. Yep.
Yeah, exactly. So that's it.
Okay.
So so you just click get involved or join the Academy. Yeah.
Okay.
So choose join the Academy, and then we will get your request.
All right. Perfect.
Hello.
Now, we have Mariam Musa, who did put in her question. So here it is. So she's a health information officer. She was unfortunately cut off due to connectivity. But she says, as a health information officer, she feels that she and other people doing this data work, working with digital technologies, are not recognized. She says, we deal with data and patient information, and she hopes you will like us to work with you. How do you work to support the recognition of professionals who are using data, practicing digital health, working with, in many cases, important information? What would you like to say to Mariam around the issues that she raises?
I would say, Miriam, you're doing a great job. And you just have to be proud of it. So basically, the people behind health informatics or health information management could be rarely seen in the forefront of the health response, but you're doing a great job. And so one of the things we try to do, and we've been working through, is to create a platform where we give opportunity for people of your kind to be able to have that exposure. And I'm sure that's what Teach to Reach is also doing, to have that exposure. And we have started up a forum called the Insight Learning Forum, and we do monthly webinars as well, just to make sure that you are able to effectively connect with the outside world and what happens with other colleagues as well. And I think we have a relationship with your hospital. We should be able to strengthen those kind of partnership and see how best you could be part of health informatics, working or learning group.
Thanks, David. So a quick word now about why Teach to Reach 10, the 10th edition of this massive open peer learning event for health workers, is focusing this time on climate change and health. Last July, we asked the Teach to Reach network to share their observations of climate change and health within less than 10 days. 4,700 had responded to the call to action, and you painted a very scary picture. We asked you, is climate change a threat to the health of those you serve, and why? And you told us two things. You told us, first of all, that most of you as health workers are trusted advisors, are part of the family, part of the community, or a trusted friend. And the second thing you told us is here, and that is that when we asked you, is climate change a threat to the health of the community that you serve? Pretty much everyone said yes, it's a high or even the highest threat level for the community that I serve. And most of you are worried about climate change and health. And this is why this Teach to Reach, the 10th one, is set under the banner of health workers sharing experience on the front lines of climate change and health. You can go right now. Finally, we have opened up the Teach to Reach website, and you can go to the event website this time and look at both partners such as the Geneva Learning Foundation, UNICEF, DevEx, Gavi's Zero Dose Learning Hub, as well as the Gavi Vaccines Work blog. And of course, today we're speaking with eHealth Africa and EHA Clinics, two of our main partners for this 10th edition of Teach to Reach. On the Teach to Reach event website, you can also look at the schedule, which has now been published, and some of the folks that will be involved. But everyone has a voice to Teach to Reach. Whoever you are, wherever you are, you'll be able to join Teach to Reach, share your experience, and have your voice heard. Which is why we're going to go back to David, because it seems like this is the lightning chat with the greatest number of questions coming in. So I'm going to try to identify this next one from Sharon Aguti. Can the digital health skills be assessed? Where can that information be found? And I believe, I think there's at least one other, so kind of a related question. But let's first take this one from Sharon.
Yeah, Sharon, that's a great question. So I think there are a couple of digital health skill assessment tools on the net, but that also depends on whether you want to do an assessment of your skill or an assessment of an organization which you're part of, all right? So a couple of those tools are out there. So I would say recommend that you look out for them. But if you can't, I'm sure if you've reached out to us, we should be able to we do more of a participatory assessment. All right. We could use our checklist to do that and then offer recommendation on what kind of skills you should be able to prioritize.
All right. And David, let's talk briefly. Can you explain to us? So we know, and it seems like many, at least participants from Nigeria, already know of eHealth Africa. What is EHA Clinics? Because EHA Clinics has a relationship to eHealth Africa. Can you tell us what is EHA Clinics and what is that relationship?
Yeah, so thanks, Reda, and thanks for those perhaps who might possibly require that level of information. So yes, EHA Clinic actually is an offshoot of EHA Foundation. It's a private, for-profit entity. Basically, saddle wheel building quality primary healthcare setup. To deliver services to the community, different community setup. And you could see that in our setup although we're set up to offer primary healthcare, but that setup, it's one of the best standards you could see in the world, and connecting with the community to assess quality healthcare, even with a private, setup or kind of a private setup kind of like way. And that's very much different. And one of the things we've done also with EHA Clinic is to really establish that connection between the healthcare provider and the community. So from the EHA Clinic, we run a program called the REACH program, which is a community-based program that creates demand for services, and taking the service to the people and make sure that they don't have any barrier to any form of healthcare opportunity. And I would say that just connect with the EHA Clinic. We have locations. We are in different locations in Nigeria. We're in Kano. We're in Abuja. and expanding to we are in Lagos and expanding to other cities as well in Nigeria.
All right, and David, can you also clarify for us, eHealth Africa, is not only in Nigeria, you now have actions and activities across different African countries. Can you tell us all about that? And also, does that include countries where French is the spoken, one of the spoken languages?
Yeah, correct, Reda. So we started off in Nigeria. So Nigeria is like Hope Front, but cumulative in the last 14 years, we've worked in 22 countries, including having a project in Germany.
Okay, wonderful. All right. So we have many more questions piling up this time. It's too much for me, Charlotte, but I know you and Maria have been keeping up. So who shall we hear from next? I can, of course, show the question on screen, but first, if you can guide me where we should go.
Whether I'm inviting Gifty to unmute, since she already typed her question or her thoughts and comments in the chat. So Gifty, over to you, and please do start by introducing yourself.
All right. Okay, thank you. Hello, everyone. I'm Gifty Akosia Jigbe, public health nurse from Ghana. I work in the Goma West District. I work in the immunization field and also work in the disability field. So please, my question for Dr. Mr. David Akpan, right? Okay, so please, I want to know, in the health sector, I know we are progressing from the paperless to digital, where even requesting for drugs, we are now using GILMIS, where you have to request for your drugs using, the online method. And then also even our reports are now on DIMS, like District Health Information Management System. And I also want to know, looking at these two things, it's just like the end result of whatever we are looking for. What about when it comes to risk communication activities? When we talk about SBC activities that we've been doing for all our works, anytime there are new vaccines, we need to go out there to spread the news, advocacy. And when they come to the facility too, you still need to educate them before they even go home. A mother coming to the facility for immunization or any other health services. So I want to find out, I personally want to know, looking at me in the field where I have to use the sign language in the form of using it to break language barrier to help this deaf community to be able to pick up or to also be involved, to be included when it comes to risk communication. What about my other colleagues? Okay, so when they come, not all the deafs are educated. Some are educated, but some are not. We still have illiterate deafs who have not been to school. So we have this Google method where maybe when you speak, it translates. So maybe I'm Anglophone, and then when I speak, I'm able to communicate with somebody from the Francophone because it will translate to French for that person. What about sign language? Can we have something like maybe whilst I'm interpreting, it is writing, or whilst he is signing, it is writing? Like that. That is my question. Thank you, Mr. Akpan.
Thank you so much. That sounds like very brilliant question, and it speaks to the issue at hand. So moving away from closing the digital divide to closing the social exclusive divide, for populations, who are not having limited access to health information, most specifically, not even service, health information, which is very important. So there are solutions that have been used, like you've explained about Google, which talks about the use of an IVR, they call it interactive voice response, functionality, which you communicate and is able to, interpret that or give you what it means. And I think there are solutions that have also been developed to make sure that even the beneficiary can directly, instead of writing or not able to write, could just speak to the device, and that communication is passed through to the health worker, and the health worker can do same and provide that exchange, to the beneficiary as well. So I know that in terms of the sign language, that's a work in progress, because that's another area to really look into, and that is where artificial intelligence is coming to play, where they're looking forward to seeing how they could use models that is able to create visuals, so that it's by just describing what you want to demonstrate, the system is able to interpret that and put up a visual. So I would say it's a work in progress. I don't think there's an existing tool in that aspect, but I can tell you that this is something that developers are also thinking through, so that we can close that socially exclusive divide that we have dealing with our very priority population.
Thanks, David. Believe it or not, we're almost at the end of this lightning chat. This team, there was an earlier question about green digital health. Now, the discussion on digital green health in general is just starting up, but we have this question from Benjamin Mukapa, who, I meant to take myself away, not his comment. How can the principles of a circular economy, so to reuse, repair, recycle, be applied to the procurement, maintenance, and end-of-life management of digital health technologies? Is eHealth Africa involved? I think that would be the interesting thing to ask of you in innovative business models or policy incentives to really encourage more sustainable life cycle management of digital health products and services. What happens to all those tablets that are used in surveys, to all the PCs that become obsolete and get replaced? It's of course an issue for everyone everywhere in society. But David, is eHealth Africa involved in efforts to address that set of issues?
I would say not at the moment, but it sounds very interesting. One of the challenges you will have is that several devices used for digital health innovation are personally owned. All right. I think a couple of donors or partners who had been involved in digital innovation scale had reduced, providing devices, right? So they rely on people's personal devices. So in terms of addressing that gap, it's an interesting area of work that we need to work with, let's say, country's Ministry of Health on how to really, and maybe looking at the information technology ministries or agencies to see how we could deal with recycling of digital health products so that we don't create another environmental crisis for ourselves in just in the way of trying to advance digital innovation, but you're also creating another crisis that might be a problem for every one of us. So great question.
Thank you very much indeed, David. I hope that you are left thirsting for more and frustrated because this is the end of the lightning chat. Why am I happy about this? It is because this is ahead of Teach to Reach 10, and that is when we'll be coming together. Over 21,000 health professionals from more than 80 countries are registered to participate, contribute, benefit in various ways to the event. We're pleased to announce today we finalized the schedule, even though there are still tweaks being made. So you can go to the Teach to Reach website and see that, and see, of course, everything from our great sponsor and partner, eHealth Africa and EHA Clinics. Really happy to have connected, David. Thank you, Charlotte, and to Maria Manzana will be your trio of hosts for Teach to Reach 10. That's in 6 days. And we've just been joined by Becky Tagbo. We're really, really grateful. I do want to, before we close, share with you something that is not yet public, so it's a little bit of a scoop, and that is that we are about to launch what we're calling the Immunization Collaborative. This is in support of the Nigeria Movement for Immunization Agenda 2030, and this is in partnership with UNICEF and the National Primary Healthcare and Development Agency of Nigeria, NPHCDA. So once again, thank you, David from eHealth Africa. Thank you for sharing about EHA Clinics. A lot of interest in today's session about your organization and the work that you do. This afternoon, there is one more lightning chat today, and that is with Kate O'Brien. She's the Director of Immunization, Vaccines and Biologicals at the World Health Organization. And we're going to ask her questions and invite you as Teach to Reach participants to ask her your questions about climate change in relation to immunization. Once again, thank you. We're now going to do a little bit of a rewind with these, and then we take notes. and honor Dan Arewa's message, who says, as Muslims, we have congregational prayers on Fridays, which sometimes conflict with our meeting schedule. We will, of course, take this into due consideration, and thank you for sharing. We're now going to do a rewind. So to make sure we do want every community, all communities, to be able to participate in Teach to Reach. So here we go with the rewind of the messages. Let me go back to the top, and let's maybe switch gears a little bit. Yeah, here we go. See, there are lots of messages. Apologies if we did not get to your question. We'll also show all of the introductions that came in.